So let's get started. I'd like to welcome everyone, first of all, for joining today's webinar as part of the Stroke Foundation's National Webinar Series. We will be recording the webinar today, so if you have a colleague or anyone that may have missed the session, you can always share the recording link with them afterwards. We will encourage you to use the chat if you want to share anything along the way throughout today, your experiences or comments. We also have a Q&A option if you've got questions, so please do add any questions to the Q&A, but keep the conversation going in the chat. So I would just like to start today's session by acknowledging the traditional owners of the lands on which we all meet today and the lands on which our Stroke Foundation offices stand. So I pay my respects to elders past and present, and also extend my respects to Aboriginal and Torres Strait Islander people who are with us here today. I would specifically like to acknowledge the Wurundjeri people of the Kulin Nation where I work and live. And we invite you to introduce yourself in the chat and let us know where you're from and acknowledge the land on which you're joining from as well. So my name is Simone. I'm the Engagement Coordinator at the Stroke Foundation, and I'm really excited to be joined by three special guests today that will be joining us. So I'd like to start by introducing Joe Miller, who is a survivor of stroke and a proud Cooma man. And Joe is also a volunteer stroke safe speaker for the Stroke Foundation, and he is extremely passionate about raising awareness for stroke and shares his story in our stroke journey.
I'd just like to acknowledge the Camilroy elders past and present and those who are to come. I'm in Tamworth today, and thank you for inviting me on the panel.
No, we're so grateful that you're here with us, Joe. I'd like to invite or introduce you to Gabrielle Epsworth, who is the Aboriginal Liaison Officer for the Royal Melbourne Hospital in Victoria. And Gabrielle is a proud Wankamara and Bakinji woman from Narromine in New South Wales. Gabrielle works with Aboriginal and Torres Strait Islander patients and their families in the hospital setting, supporting the provision of culturally responsive healthcare. And Gabby has a background in state health policy, communications and government relations. So just welcome to Gabby. I would like to introduce Rebecca Clinch, who is an Aboriginal Brain Injury Coordinator, also known as ABIC, over in WA, and she's working for the Healing Right Way project. And Rebecca is a proud Ngaju Yamachi woman. Rebecca is passionate about helping her clients throughout their rehabilitation and recovery, and also shares her story in our stroke journey. And sitting with Rebecca, you'll see Luke Hayes, our state manager for WA and South Australia. And Luke is also joining me to present the webinar today.
Thanks, Simone. And on behalf of Rebecca and everyone in Perth, I'd like to acknowledge that we're meeting today on Wajak Noongar country, and we pay respect to the elders past, present and emerging as well.
And so thank you again for coming today. We'd like to get a sense of who might be here today with us. So feel free to share in the poll that's about to come up, hopefully, your profession. And you're welcome to also share in the comments where you're joining us from, whether it's a hospital site or a community setting. So just a brief outline of the session today. We are going to be talking about our stroke journey and really introducing you to the booklet. And our aim is that you come away feeling much more confident about using the booklet. We're going to give you a bit of background to the Stroke Foundation. I acknowledge that there may be some people here today who are new to our work and what we do. So Luke will touch on what the Stroke Foundation does. Then we'll dive in to talk about the booklet, giving a bit of background about why the booklet has come about and who was involved and what that process looked like. Then we'll really look at how you might like to use the booklet, covering some important pages. And Gabby's going to share some of her experience of using the booklet already, both personally and professionally. And we'll also talk about cultural competency. It's really important to touch on that when we're looking at a booklet for Aboriginal and Torres Strait Islander people. We'll touch on other resources that you might want to know about and that might be helpful in your work with Aboriginal and Torres Strait Islander survivors of stroke. And then we'll have some time for questions at the end, particularly for you to think about questions to ask our guests. We're really privileged to have all three of the guests joining us today. So I'm going to hand over to Luke.
Thanks very much, Simone. Sorry, I'm sat a bit back from the computer, so I'll try and talk quite loudly so that the mic picks it up. I'm here today to co-present with Simone, and thank you to our three panelists as well very much for joining us. I'm just going to give a brief overview of Stroke Foundation. Most of you will be very familiar with the work of the Stroke Foundation, but the Stroke Foundation really has 3 or 4 key aims, and that's around preventing stroke. And we do that through supporting health checks across the nation. You may have heard of the Australia's biggest heart blood pressure check, and there are a number of other health checks that we do. We also provide community education around the fast signs of stroke, so that educating the community around what stroke is and how to recognise it, and then what to do, so engaging with health services to make sure that they're getting the care that they need. We also focus on treatment, so supporting yourselves as hospital teams delivering stroke care nationally through national webinar training such as this, the national clinical guidelines, through Inform Me, which is the online web process that provides information and support to clinicians, through Enable Me, which is the similar process for stroke survivors and carers and their families, and also through the annual audits, of which we're just about to see the results from the 2021 acute stroke audit shortly, so I'm sure you'll be in touch with that. We also focus on the recovery arm, and I think this is a really important aspect. So this is around supporting stroke survivors, their carers, families and friends in terms of moving from hospital back to the community with information and advice and other support. And the other piece of work that Stroke Foundation does with its role as the voice of stroke in Australia is around research. So it's supporting clinicians and researchers to really innovate and collaborate on stroke-specific research. So I'll hand back now to Simone to talk a bit more around the background of our stroke journey.
Thanks, Luke. So this is a little bit around the why, I guess, our stroke journey was developed, and I'm sure that everyone who's joining us today is aware of the gaps in health outcomes for Aboriginal and Torres Strait Islander people. And for stroke, the hospitalisation rates are 1.6 times higher, the death rate 1.3 times higher, the burden of disease 2.3 times higher, and also for the median age of onset of first stroke for Aboriginal people is 54 years, so that's a 17 years younger. So seeing obviously stroke occur in a much younger age group for Aboriginal and Torres Strait Islander people. We previously, prior to our stroke journey, we know how important getting good information is for stroke recovery, and that information needs to be tailored to the needs and preferences of individuals and communities. And prior to our stroke journey, Stroke Foundation was using Journey After Stroke as the primary resource that you could access on our website. This was a fantastic local resource developed by the amazing team up in Townsville Hospital, and it was really fantastic that we had this available. However, we were aware that there was limitations in terms of the appropriateness of using that in other communities, and even just having a look, it's the one on the left, at some of the imagery and graphics, that wouldn't necessarily be as appropriate to be used elsewhere. And then Joe, who had a lot to do with the development of the middle resource, which is written by the mob for the mob, and with Rachel Peake at Tamworth, they created again another fantastic local resource where the whole community, it was a real grassroots approach to the development of the resource, and really just a fantastic resource around stroke recovery. So that was sort of the second option that was developed by Rachel and her team and Joe, and really, really good feedback around how well that helped with engagement in the communities and also the health outcomes for Aboriginal and Torres Strait Islander people in those areas. So we took our My Stroke Journey resource, which is part of our suite of stroke recovery resources, to Quake, Queensland Aboriginal and Islander Health Council, and got them to look at what sorts of needs were there for a more national resource that might be able to meet some of the needs in the interim. And Quake were fantastic and got back to us and, really shared that there were a few key things that needed to be considered. And they were things like keeping the language simple, using more stories, images and colours. And you can see that they were used very much in the other two resources that I shared on the previous slide. They thought that it was good to include more information about finances and work, and to make sure that people know about Aboriginal community controlled health services as well. And I think really one of the important findings from that initial work that Quake did were to make sure that the booklet didn't just end up on the shelf, that actually there was engagement, there was good use of the booklet, and it was actually helpful and able to change outcomes for Aboriginal and Torres Strait Islander people after stroke. So we went away and then looked at drafting content, which obviously was shared with a range of different people. And some of the people that we've worked throughout this project were Aboriginal and Torres Strait Islander people with lived experience like Joe, and some of the others that are featured in the booklet, but also others beyond that. Aboriginal and Torres Strait Islanders organisations such as Quake, and Aboriginal liaison officers and Aboriginal health workers. And you'll see that not just Rebecca's story, but there's also a story from Harry in there from up in Alice Springs Hospital as well. We worked with health professionals. Some of you are probably listening in today, medical professionals and researchers with experience in stroke as well. So we drafted the content, we finalised the content, we looked at gathering stories that were a really key part of the booklet, which Luke will touch on a little bit more shortly, and then moved into really the graphic design phase this year, which we went back to Quake and worked with them on making a booklet that visually was culturally appropriate and safe for Aboriginal and Torres Strait Islander communities. So I'll hand over to you again now, Luke. Just to finish up though, that, acknowledging that this is probably just the start, that our stroke journey isn't the end point. I think our vision would be that we would have local resources across Australia, but this is really a way that we can make sure that Aboriginal and Torres Strait Islander people get the information that they need about stroke, and that it's a culturally safe resource. So it's a significant step forward for us, and we look forward to continuing this journey with everybody.
Thanks, Simone. Yes, and as Simone said, our stroke journey is the product of a long period of work and the work of a lot of people. So, we stand on the shoulders of giants in a lot of respects. But the great thing about our stroke journey, which was launched in Stroke Week this year, the first week of August, is that it really covers so much of what people need to know about life after stroke. It includes those stories that Simone mentioned, which are such a powerful way of engaging with Aboriginal and Torres Strait Islander patients and survivors of stroke and their families and health workers, to really, present that great step forward to ensure that Aboriginal and Torres Strait Islander people get that information and support they need after a stroke. So the big questions that our stroke journey answers, and many of you will have seen a copy of it because they've been going out since the launch in August to hospitals right around the country, which is great. But those big questions that are answered in our stroke journey are, what is a stroke, and there's some great sort of explanations of that that process for Aboriginal and Torres Strait Islander stroke survivors. How will stroke change me as a stroke survivor? How do I look after my health? So it's that really secondary prevention key aspect that is great to get that message across, because we know, as all of us know, the risk of having another stroke after having your initial stroke is high. How do I get ready to go home? We all know that the hospital experience can be really challenging, even for non-Indigenous people, and it is even more challenging in many instances for people who are Aboriginal and Torres Strait Islander as well. So that process of sort of getting people ready to discharge is really key. And then what happens for the person once they get home? So it's how do they sort things out once they're there? That's the big question that our stroke journey really touches on. So it's a great resource, and I think it will be really great support for you in your work with Aboriginal and Torres Strait Islander stroke survivors. And we'll go through a bit more on how to use it a bit later on. But I'll also just moving on to the next slide about really that targeted audience for our stroke journey. Obviously, the key audience is survivors of stroke and their families, carers and friends. But a big part of the message in the design of our stroke journey was sort of around, it's also around supporting communities, because that was the big message from Aboriginal people who were consulted, is that the community, the strength of the community in supporting the individual after they've had their stroke is critical. It's been designed to support your work as hospital stroke teams, so stroke coordinators, health professionals, and importantly in this case, Aboriginal health liaison officers as key parts of the processing in terms of supporting Aboriginal and Torres Strait Islander survivors of stroke. And the other key group that we were designing our stroke journey for is community Aboriginal health workers through the Aboriginal Community Controlled Health Organisations, or ACCHOs, just acknowledging that importance of community in delivering good healthcare to Aboriginal and Torres Strait Islander people. So moving on now to how to use it, and I think this is hopefully the key bits of what we're going to be talking about today. You'll see shortly a poll will come up, and as we step through this slide and the next slide, and also hear from Gabby in terms of her experience of working with our stroke journey, it'd be great to get you to think about, how you might use it, and really great if you could think about the way you use My Stroke Journey, the resource that's been designed for non-Aboriginal stroke survivors and their family members, but with some additional thoughts about how you might use it differently in the case of Aboriginal stroke survivors and their families. So really the thing that we're keen to ensure the message gets out is for every patient, every time they get a copy of our stroke journey. And we're really encouraging that provision of our stroke journey to the patient or their family members happens in the first few days after admission. So they're really able to make the full use of it through their journey, through their stroke episode of care, and then beyond back into the community. It's critical then that you as a stroke team work with the patient and their family on completing the various sections, and you would see, if you've got copies or if you've seen copies, there's a great section on pages 12 and 13 about really identifying who you are in the team, so that families and patients can feel more comfortable about knowing what your role is and who you are, and then asking questions when they need to. The other key bits of information that are great to complete will be the stroke rehab plan on page 35, which really steps through that process around identifying the goals of the person in terms of what they want to achieve through their stroke rehabilitation and beyond. And then moving on to page 46, which deals with medications after stroke. That's an incredibly important section in terms of getting that right, so that people know what they should be taking, how they should be taking it, how often, to really minimise the impacts of stroke on them and reduce the secondary risk. And there are also specific sections on secondary risk prevention in terms of healthy lifestyle and diet, and what to do in terms of managing that secondary risk. And they're dealt with on pages 53 and 54. And then the final section around that's important to complete with your patient will be the discharge planning section in pages 61 and 62, which really, just helps with that, preparing that person to transition out of the hospital, which can be, as we all know, a really challenging time for any patients, but also their family members and communities in this case, in terms of accessing that support. And lastly, it's really around documenting in the patient records that our stroke journey has been provided, and that the relevant sections and plans can be completed, because as we all know, if it doesn't get recorded, it didn't happen. Yeah, so thanks, Ash. If we can move on to the next slide. And this really looks at, again, using our stroke journey and some tips and suggestions that would be great for you to consider. We know it's a new resource, and that it may take time for you to, as a team, work out who's best placed to deliver it, and it's flexible in terms of that being what works best for your team. But again, it's about making sure that there are key people to drive that delivery and use of our stroke journey. Obviously, that can range from case managers, Aboriginal liaison officers, or health workers. If you have a stroke working group, or the broader multidisciplinary team, in terms of their involvement in different aspects of the sections to complete and the information to provide. It would be great if you could consider whether our stroke journey could fit with a quality improvement project. So this might be something as simple as an audit of how often it gets provided to people in your unit or stroke service area, through to more complex quality improvement projects to really understand how you're using the document, how it is useful for you and for your patients. And it'll also be a great opportunity for Stroke Foundation to get feedback, so that, as Simone mentioned earlier, that can feed into future iterations and reviews of our stroke journey, so that we're making sure that it's meeting the needs in the best possible way. The other suggestions include making our stroke journey a topic that gets covered at your case conference or multidisciplinary team meeting. And one of the ways that could be useful to consider doing this is including on your case conference or MDT form, if you've got that, so that it's a prompt for you as a team to ask that question of the use of OSJ and whether it's useful, how it's useful, how it could be improved. And again, coming back to the documentation, making sure that we do document what we do for our patients, so that there's a clear evidence and audit trail to support that. There are a number of examples. Gabby's going to talk shortly about ways that she used it, but we're also getting feedback from other health services. For example, Western Health in Victoria are including it in a bag of various resources for their Aboriginal patients, toiletries and a number of other things, so that they've got a specially designed bag that goes to all Aboriginal patients, and for Aboriginal and Torres Strait Islander stroke patients, they're also going to include our stroke journey in that. So there are different ways to really get that resource to your patients, and it'd be great to hear from Gabby shortly. Before we do hand to Gabby, I'd just like to remind people that there will be a feedback survey coming out for all attendees at this forum. So it'd be great to get your feedback about what works and what doesn't from your perspective with our stroke journey as well. But I'll hand over to Gabby now to talk about her experience with using our stroke journey. Thanks, Gabby.
Thanks, Luke. I hope everyone can hear me all good. As mentioned, I'm the ALO for the Royal Melbourne Hospital. I'd like to also acknowledge the traditional owners of the lands that the hospital site sits on and that I live on, the Wurundjeri people of the Kulin Nations. And I acknowledge that this always will be Aboriginal land. I have had lots of experience with stroke, both in my professional and my personal life. Here at the Royal Melbourne Hospital, we work with Ambulance Victoria with our mobile stroke unit, which has been a really great resource for stroke survivors in Melbourne, and really innovative as well. And so we have a really massive stroke ward where we can be seeing anywhere from 1 to 10 Aboriginal stroke patients a month. It really does vary. And each admission, it's extremely scary for people coming into hospitals, for Aboriginal people especially. And if you've come in and you've had a stroke and you have, deficits immediately after, you can't speak properly, you might be in and out of consciousness, it's so incredibly traumatizing for people. And it's also really hard for their families. We found it really hard in COVID that we're not able to have visitors into the hospital. And where we would usually have family members, translating for their loved one in the hospital bed, we've had to think of new and innovative ways to communicate and to get information across to everyone who needs it. So we've really loved using our stroke journey booklet. I think the biggest thing that the patients really love is that it's a booklet for them. It's not just a pamphlet that gets handed to them with some generic information and some generic phone numbers. It has the ability to be personalized towards what their stroke journey was. When you're in hospital, it's an influx of information. It's so hard to keep across everything that happens. We find that one of the biggest things people don't realize is just how many people are involved in a multidisciplinary team when they come into hospital. They sort of have this traditional idea that you have a doctor, you have a nurse, and you might have a social worker. And then they get onto the ward and they see, oh, we've got an OT and a physio and a speech pathologist. And you've got the ward clerk and the clinical assistants, and they get overwhelmed and trying to remember everyone's names. So having that little booklet where you can put in who your speech pathologist is and you can put in who your OT is, which is really great, because we also get family members calling up and saying, my dad, he wants to go back to work, like I need to speak to the doctor, and the doctor says, no, you actually need to speak to the OT, and they're sort of stumped. They're like, I don't know who the OT is. So being able to have a booklet that tells them exactly what's happened to them and exactly how we've come in to help is really important. Having all their medications listed and all the interventions we've done so that they can take it home to their loved ones and say, this is what's happened to me, this is how we're going to work towards getting me back to being healthy and to living my life again. We've also found it really good in COVID that we can put this information in because we aren't seeing family members face to face. So being able to write in the booklet and then give it to the families has been really helpful. And also too, just seeing friendly blackfella faces in the booklet, so important. You know, we seeing an Aboriginal health worker in a blackfella polo shirt means the world to our patients. We always see that when we come in with our Deadly Choices t-shirts, the patients always respond really positively. And, you know, judging by the smiles, everyone knows what the Deadly Choices t-shirts are. So having that representation throughout the booklet from stroke survivors and Aboriginal workers is really meaningful engagement for the patients. I unfortunately also had a really personal experience with stroke. Back in August, my dad had a stroke in National Stroke Week of all weeks. And he unfortunately was admitted to the Royal Prince Alfred Hospital in Sydney. So he was, I think it's like 800 k's away from me, and with lockdown and everything that happened, it was really scary. And as a lot of health workers will know, that when your family member gets admitted to hospital, it's really hard to not be their health worker. The second I got the call he was in hospital, all I wanted to do was get on the phone and speak to the doctor and speak to the OT and figure out what had happened. But my mum always tells me that I need to stop social working my family, and that she was more than capable of sorting it out. But unfortunately, what we found was that, and it's really common in Aboriginal communities, that health literacy rates are really low. And as a health worker who works in stroke, I was asking questions of, you know, what type of stroke did he have? Did he get into the CT quickly? Did they thrombolyze him? You know, is he on presses? All these questions. And my mum couldn't answer them because, you know, like a lot of Aboriginal community members, she didn't fully understand what stroke was. We have a lot of heart issues in our family, but stroke is something we don't come across very often. And so in being able to send her our stroke journey, she could fill in that my dad had actually had a transient ischemic attack before he'd had a massive ischemic stroke. He did get into a CT and he was thrombolyzed, and that he was on the adequate medications. And, you know, in also having this booklet, they had the resources and some background on recovery. As their daughter, it probably wasn't well placed for me to talk about how you're going to recover from stroke in relationships and sex. But luckily, the Our Stroke Journey covers that. And I think it's really important that it has information that would otherwise be really shame job for mob to talk about, and that they can access that information quickly. And I think also in acknowledging that health literacy rates are low, when you don't have strong health literacy, it's not just easy to pick up your phone and Google stroke resources and find a reputable source with good citations on how to recover. As health workers, we can do that, but for patients and their family members, that's not necessarily a skill they have. So having a document that has reputable sources on recovery and what it's like after stroke is really important, because we know that we're giving patients and their families the right information and correct information. So it definitely really helped. It put my mind at ease to know that my family had that information, and to also know that I knew what was going on as a clinician. And yeah, you know, I couldn't have imagined a more apt or sort of, I guess, ironic time for this to happen to my family. But just, yeah, having that comfort of knowing that they knew what to do and they knew who to call if something happened. And now they know that this is the resource that's available to them, and they know that they can call Stroke Line at any point in time if they have more questions about my dad's recovery, or if someone else has a stroke in my family, they know that's a resource they can access. So yeah, that's been my experience with Our Stroke Journey and the Stroke Foundation. And I think another reason why I'm so happy to be here talking about it is because I think when we talk about it as community members, it makes it a safe space for people to come into, and it makes it less taboo and less shame to talk about the issues that affect us. So yeah, really happy to be here today. Thank you.
Thank you so much, Gabby. I think when Simone first mentioned that you might be able to come and talk to us, I think the absolute power of your experience and what you've been through and how you're using it, just made you absolutely perfect for this webinar. So thank you for having the courage and sharing your story, because it is just really powerful. I'm going to just talk a bit about cultural competency, which really underpins so much of what our stroke journey is about, and so much of the work that we all do with Aboriginal and Torres Strait Islander patients. And really just a question for those of you in the audience who are non-Indigenous health professionals. Really just a question around how many of you have had training in cultural awareness or cultural competence through your health service or hospital. I think that's you may feel comfortable sharing that in the chat, but also just something to think about. I know it's a really key plank of most health services around the country, but yeah, just really important to think about how competent we are in working with Aboriginal and Torres Strait Islander people, for those of us who are non-Indigenous. There are lots of cultural competency training around, and really encourage each of you to go back, if you haven't had that training, to go through your own health services and access that. It's really an important process of starting to understand the challenges for Aboriginal and Torres Strait Islander people, particularly around their health and accessing hospital and rehabilitation. And we'll be hearing later today from some of our panel around some of the experiences that they've seen with their Aboriginal clients around that. One of the things that can be really challenging for non-Indigenous health professionals is simply understanding whether the person that they're working with identifies as Aboriginal and or Torres Strait Islander. I think we all know that our data collection around usage of health services for Aboriginal and Torres Strait Islander people can be, there's lots of gaps in it. And it can be quite poor at different times. So it's really important to feel confident about asking the question of your patients, whether they identify as being Aboriginal and or Torres Strait Islander. And that opens the door to then having that conversation about what resources are best suited for them. Obviously, it's key in any cultural competence is to use your resources that you have. So whether that's training or, in this case, building, really good relationships between yourselves as stroke unit staff and your Aboriginal health units, Aboriginal liaison officers or health workers. They're the kind of reservoirs of cultural competence for your organisation. So don't hesitate to reach out and engage with them. I think it's a great opportunity, and many stroke units around the place will already have good relationships with those staff members. But yeah, really encourage you to build on those. And yes, obviously cultural competence is about providing a culturally safe environment so that Aboriginal and Torres Strait Islander patients can access and experience the best outcomes while they're in hospital. There's a great example, or a number of great examples, and I can see some coming up in the chat around mandatory learning packages that have been co-designed with Aboriginal liaison officers, there's some feedback around self-learning packages that have been designed, particularly around Tasmanian Indigenous history and culture. So it's great to hear back from Sarah, your point around, making sure that what training you access really does address current day challenges and how individual health professionals can really assist in that space. So I think that's really good to go back through your own health services to give that feedback. But also there's a range of resources out there through other avenues. For example, the New South Wales Health, My Rehab, My Journey, Gaji Gaji project and resources are freely available to everyone, and are not necessarily just specific to New South Wales Aboriginal and Torres Strait Islander people. There's also great resources. For example, in WA, we've got an Aboriginal person-centred training module that's available through the Training Centre for Subacute Care. In WA, that's also available to non-WA clinicians. So there's a range of resources out there, and really useful to go out and I know that if you're interested in accessing any of those that we've talked about this morning, perhaps just leave us a comment in the chat and we can pick up on that and get back to you. I'm just going to hand over now to Simone, who will talk to us a bit more about other resources that are available. Thanks, Simone.
Thanks, Luke. So if you've got a copy already, or if you've seen our Strait journey, you'll notice that there are a number of different resources that are included throughout the booklet, particularly from page 63 on, when you're looking at how do I sort things out when I go home. So I'm just going to highlight a couple of the key resources that we would suggest you go and check out. And I also invite others in the comments to share some of the key resources that you would also suggest as Aboriginal liaison officers. But obviously, particularly for non-Indigenous clinicians, remembering the ARCHOs, so the Aboriginal Medical Service and the Aboriginal community-controlled health organisations. That was something that Quake really wanted to highlight, make sure that as many patients as possible are aware and are linked in. Aboriginal Quitline is available, so not everybody is aware that there's specific services within some of those secondary prevention or primary prevention spaces as well. Thinking about WellMob as a really great resource as well. It's a co-designed project and it brings together a range of different resources online. And that WellMob was made by and for Aboriginal and Torres Strait Islander people. So the key focus for them is also on social and emotional wellbeing. And I highly suggest, if you haven't gone and checked it out, go and check it out. As well, Australian Indigenous Health Infonet from Edith Cowan University. We will have, I think it's already on there, our Strait journey will be on there, so you can find it via the Health Infonet. But again, a really reputable source, particularly for clinicians to refer to. Thinking more about support services, there's a yarning circle, which Rebecca probably has more information on through the Healing Right Way project over in WA. It's a unique circle that started for people over the age of 18 who have had a stroke or a traumatic brain injury, available in Perth. But also thinking about, mental health services, there's Yarn Safe and Yarn Space through Headspace. NDIS and My Aged Care, and just a note for people to remember too that My Aged Care is available for people over 50 if they identify as Aboriginal and or Torres Strait Islander, or 45 if they're homeless as well. So just keeping that in mind too when you're thinking about support services. But I do encourage you to share if there's others that you've been using or that you'd like to share with everyone here today. Please comment in the chat. And also, a really big key resource for us, obviously, at the Stroke Foundation is Strokeline. Strokeline is our national helpline. It's run by qualified health professionals who have experience in stroke, and it's available Monday to Friday, 9 a.m. till 5 p.m. Eastern Standard Time. And hopefully most of you will know the number by now, but perhaps some of the people joining may be new to Stroke Line. The number's 1800 787 653. And you can also access Stroke Line via web, so you can email us an inquiry and we will get back to you via email if that's the preference. But absolutely call Stroke Line. We will help tailor the information and support services that you need, and really make sure that they're culturally appropriate for you as well. The Stroke Line service is staffed by a range of different health professionals, from physiotherapists, occupational therapists, social workers like the amazing Siobhan, who's on that screen, and also works with the hospitals, and speech pathologists as well. So please do direct your patients to us. As Gabby, I think, really highlighted, you know, she's made it clear to her parents, both her mum and dad, that Stroke Line's a service available to them, and also to anyone else in the community that may have had a stroke. I can see that Rebecca's also got her hand up, so or Luke, I'm not quite sure who, so I'll hand it back to you.
That's okay. I was just mentioning about the resources, like your client's family is a great resource to get to know about Aboriginal culture and the way Aboriginal people, like how we do things. Even like the community Aboriginal services, the AMSs is another good place. I know you guys are in COVID area, so probably not now, but if you ever get lifted, that would be good resources for you guys. Because it's quite like, when I did a grad program a couple of years ago, it was nice when a couple of non-Indigenous staff members came up to me and asked me, how can I be more culturally aware? I want to learn. This kind of stuff is good to hear. And then I just like lead them to places like my experiences and what I know. And I just sent them to like other Aboriginal organisations around Perth, and getting in there and knowing your community, your Aboriginal services is really good as well, for a great resource. I just wanted to say that.
I think it's fantastic advice, Rebecca. And, you know, we should probably have in there, you know, the Aboriginal liaison officers would come up there again as the best resource as well. And the patient, you know, your patients will also be able to help guide what it is that they need as well. I'm going to just quickly touch on where to access our stroke journey. I'm just aware of the time and don't want to cut the Q&A too short, because I think, you know, really Joe, Rebecca and Gabby are the stars of this show. But where you can get our stroke journey, if you haven't already got a physical copy, you can download it from the Stroke Foundation website today, right now. But you can also request a copy if you're a survivor of stroke, or if you've got family or a carer that may need a copy. They can call Stroke Line and get a copy sent out to them for free. And again, the number 1800 787 653, or you can email through to Stroke Line and we'll organise a copy to be sent out. Hospitals, for more bulk orders, can also order a copy through the Stroke Foundation online store, and we can put those links in the chat for you, and also included in the follow-up email that will go out with the recording of today's session. So you can also order it via the MSJ@Stroke Foundation email address there on the screen. So make sure you've got copies, and you know, we're really welcoming feedback. We will send out a feedback survey shortly around our stroke journey, so that we can continue to improve it and make sure that it meets the needs. So I'm going to finish really most of the talking here and hand over to the panel Q&A. So if you've joined late, just to remind you, we've got three fantastic guests on today, and we're really, really grateful for them sharing their wisdom and their experience and their time with us. So we've got Gabby from the Royal Melbourne Hospital. She's an Aboriginal liaison officer. We have Rebecca, who's just spoken, who's an Aboriginal brain injury coordinator from Healing Right Way project in WA. And we've got Joe Miller, who is a survivor of stroke and also a stroke safe volunteer speaker with us at the Stroke Foundation, and very, very engaged in his local community as well, as we've mentioned. So I'm going to just throw a question to start with to Rebecca, if that's okay, to get started, while we just check if there's any other questions that have come through. Rebecca, something that really resonated with me and has really sort of stayed in my mind from when we did the interview for the booklet together was around some of the challenges that Aboriginal Aboriginal people face in hospital, and that sometimes, you know, that missing country and being off country and wanting to get home perhaps sooner. I'm keen for you to just share with us what's your experience of some of those challenges and perhaps how you see our stroke journey might help in those situations.
A lot of our clients flew down from country areas, so for them it was like, yeah, really hard. All they wanted to do was go home. We had a couple that was like wanting to stay to get rehab because they knew that there was no services available for them if they went home. But the majority was like, I'm ready to go home. I want to go home. So for us, me and my colleague, we like try to encourage them to stay and to get their rehab up and running and have services for them for when they went home, so that they were there waiting for them. We tried to get them to do FaceTime or a lot of contact with their family that were back home. And we liaised with the social workers, the ALOs as well, to get them to help connect them back to their families. So I think here it's family is what they miss the most, and being home. So we just try to, like telehealth and phone calls and FaceTime and all this kind of things to get them to feel a little bit more at ease while they're down here. And I think because with the project, if you're in hospital, we go in there once a week to visit you. And so I think a lot of them were like, oh, hi Rebecca, or hi Renee, that's my colleague, and they're like, have a good little yarn with us. And then if they tell us anything that is bothering them, then we go and talk to the nursing staff and get them to like connect them back to their country or to family. And I think us being there is like another support system for them, and they like were more open to talk to us as well. So it was good that they felt comfortable enough with an Aboriginal health worker to be able to say, I'm missing home, I want to go home, and not just walk out of hospital like a couple of our clients had done because they just wanted to go home. So yeah, we just try to interact with the families and get them on board to like phone. Yeah, that was the most challenging thing, was wanting to go home. But we had to encourage them to stay for as long as they could possibly stay to have their rehab services in place when they went home.
Balancing those needs. And do you have anything that you'd like to share around our stroke journey, any comments or thoughts that you'd like to share with the people that have joined us? I
thought from the other my stroke journey to this one, it was like pretty good. I didn't mind it. And there's like more information in it, and like our clients, because that's a part of our package, our first package we call it, when we go into the hospitals to give to our clients, is our stroke journey booklet, and we just go through it with them and show them where they can put information in, like Gabriel was saying about the doctors, the nurses, the OT and all those kind of guys. And it's it was really, really good. The other stroke journey, we went through it with them, and we go through this one with them as well. So the difference that I see is the more information and the more stories that are in there, so they can read through it in their own time and see that they're not alone. Other people have been through this journey as well. So yeah, I like it. And it's not just because I'm in it.
Well, we're very grateful for you sharing your story in it, Rebecca. I'm going to move across to you, Jo. You're a survivor of stroke, and not just one stroke, you've had a number of strokes. I'm keen to ask you how important you think getting good information that's culturally safe for your community, how important is it to get that information about stroke?
Well, my journey starts, it goes back to the 70s. My father had a stroke and there was no information around, and sadly my father passed away. But when we started, the only information that was there to talk to was the doctor, and there's probably 2 or 3 questions that he answered, and that was about it. So I'm really grateful that the Stroke Foundation, and since I've had my strokes, the Stroke Foundation has actually really gone ahead getting the information out for stroke. What has actually saved me, and I believe this, is the good information that when I started with this, was following Rachel Peake, who's the stroke coordinator for Hunter New England up here. And I used to sit there and watch her talk to the mob everywhere and answer their questions. So when I had my first one, I actually knew what was actually happening. And without that, I, probably would have, like all men, oh yeah, I just had a headache and yeah, I'll go and lay down. But because I had that information, I actually rang Rachel and said to her, I think I'm having a stroke. So having good information is very, very important to actually know what's happening and what's occurring with your body, and to follow the procedures of getting to a hospital. And time is the greatest thing that saves your life. And I believe in every one that I've had, the time that I've got to hospital and got seen to is actually altered further damage. Without the information, we tend to put it off and don't go on it. We'll just go and lay down, and that's where all the problems start. So if you've got the information, you're more likely to go. Actually, you will go and well, this is what's happening. I will go and go to hospital. So it's very, very important to have that information. And people know that I'm a stroke ambassador. I go and I talk to Lions clubs and Rotary clubs and what have you. And it always amazes me that some of those learned people there don't know anything about stroke. So the Stroke Foundation and this booklet will go a long way of actually addressing and putting the word out that stroke is a real thing, and it is you need the information to be able to address your issues. And I've said all along, time is the most important key to survival. So the sooner you get to hospital, the sooner you get seen to. And the one important thing that I always push is, do not drive yourself. Ring 000 and get in the ambulance, and you will get seen instead of sitting in a waiting room. Then once you've seen, you follow up your appointments and take your medications, and things will improve. The hardest thing, I'll talk about it later, but Yeah, that's about all.
Yeah, we can come back to you, Joe, too. Thank you for sharing that. I think, you know, we're so grateful for you sharing your story, and we know how involved you were in the local resource as well as your stroke safe work that you do, and it's so important, and we really thank you for sharing that. I'm just aware of the time and just want to let people know that we'll continue the Q&A for a little bit longer, because I think, you know, it's just such a great opportunity to have Joe, Rebecca and Gabby here with us. If you need to go, feel free to listen back to the rest of the webinar. It will be recorded, so you won't miss out on the information. But if you do need to go, feel free to let us know in the comments, and we'll make sure that you get the recording. We'll also just have a couple more things to follow after the Q&A, really just a contact us, who to contact if you need, if you've got any questions, and then just an acknowledgement of the thanks to everyone that were involved in the booklet. So I'm going to just cover a question that's come up before this webinar, actually before the resource was even launched in Stroke Week, and we've had two, I think, questions relating to this already in the comments and the Q&A, and I might open it up to all three of you this question actually, and it's around, is there a preferred way to check whether someone identifies as an Aboriginal or a Torres Strait Islander person, and whether they prefer to get Our Stroke Journey over My Stroke Journey? So something that's come from a lot of non-Indigenous health professionals. If anyone would like to have, you know, I think I've got Gabby's hand up maybe, so she might want to start off to share her thoughts on that. And thanks for the great question.
Yeah, so we've done a lot of work at this at the Royal Melbourne Hospital about the best way to ask the question, are you of Aboriginal and or Torres Strait Islander origin? It should really be collected the same way as all personal data should be collected, and that's, you know, sensitively and confidentially if possible. And the best way we've found to ask it is to ask it as a part of a routine set of questions, such as, hi, can I check your name, your date of birth, your address, and are you of Aboriginal and or Torres Strait Islander origin? When we ask the question the same way every time, it is less confusing for patients. They will have heard it in a lot of other places, such as their GP, Centrelink, or government organisations. They recommend we ask it the exact same way. And then it also matches our data sets with the ABS as well. And then, you know, updating that on the system and then saying, hey, we have a resource available to you. It's called Our Stroke Journey. It's an Aboriginal and Torres Strait Islander stroke booklet. I can give you one if you'd like, or we can pass it on to your family members, is the way we found best practice to ask the question and to pass the resource on.
And Luke, sorry, Joe or Rebecca, do you have anything else to add? I can see Rebecca's unmuting, so.
Oh no, I think Gabby covered that very nicely.
That's well done, Gabby, because most people, they will tell you, yeah, I'm Aboriginal or Torres Strait. My mum is, or whatever. So, you know, and it's not invasive. They've already given you that info.
And the worst we see, and is definitely not best practice, is to ask the question and not to make the assumption. So asking, are you Aboriginal or Torres Strait Islander, and not saying, oh, you're not Aboriginal, are you? Because that's a really divisive question right off the bat, and it makes someone quite defensive. And if they are Aboriginal, they feel like they've been negated in their experience. So definitely asking it the same way every time.
I think it's fantastic advice. Thank you. We really appreciate that. I'm just aware of the time, and I know that I think, Gabby, you might also have to duck off. We might wrap it up there if that's okay. But if you've got other questions that you'd like to ask any of the guests, we can always forward them on and you know, compile some responses for you. So please do let us know if there's other questions you'd like answered from either Joe, Rebecca or Gabrielle. I'm just going to show the contact us page. If you do have questions about Our Stroke Journey, please do get in touch with us. We have state hospital coordinators, so you'll see Leah and Melita, Siobhan and Luke and Stephen's names up there, and my name's up there if you've got questions about the booklet specifically that you'd like to talk to myself about. I've been really privileged to continue the work on this booklet from December last year, but I'll say Jude Terenkovsky's had a really huge amount to do with this booklet as well, so really thank you to to Jude as well. Stroke Line, we have an email, so please, again, if you've got questions, you're not sure who to direct them to, then you can email Stroke Line. And so this is just really a big thanks to everyone who contributed to developing our stroke journey. Particular thanks to Jo, Rebecca, and all of the others that shared their story so generously in the book, and also to the Queensland Aboriginal and Islander Health Council for the amazing work that they've done with us on this booklet. And we'd also like to thank the Elizabeth and Barry Davies Charitable Foundation and the Federal Parliament Press Gallery Midwinter Ball for their support. So I'm going to wrap it up there. I'm going to stop sharing my screen and just say a big thank you for everyone that's attended. We would love your feedback on this webinar. So Ashley, who's been amazing behind the scenes, helping us with the webinar and coordinating it, she's put a link into a SurveyMonkey survey. If you do have time to do that now, otherwise when you close the Zoom call, there'll be an option to click continue that will also take you to the survey. And we'll also send the survey out with a reminder in the follow-up email that we send you. But thank you so much. Again, just keep giving us feedback, and it's been a real privilege to share our stroke journey with you. And a big, big thank you to Jo, Rebecca and Gabrielle for sharing and for being part of the webinar. And thanks to Luke as well for helping. We're going to say goodbye and stay safe and well in these challenging times.
Yeah.